Hey everyone, this is Brenda of Zackel & Associates Legal Nurse Consultants. Today's Surgical Sunday video is about surgical site infections, particularly in elective spine surgeries. You will gain a better understanding of the types of infections, their consequences, causes, and prevention methods. Perioperative nurses often care for patients undergoing elective spine surgeries, such as a laminectomy with discectomy or fusion with instrumentation. A surgical site infection, or SSI, is a complication that patients can experience. The CDC defines three types of SSIs. The first is superficial incisional. This infection occurs in the area of the skin where the incision was made. It may produce pus from the wound site, which can be cultured to find out the types of germs causing the infection. The second type is deep incisional. This infection occurs between the incision area and muscle and tissue surrounding the muscles. It may also produce pus, and the wound site may reopen on its own, or a surgeon may reopen the wound and find pus inside the wound. The third is organ or space. This can be in any area of the body other than skin, muscle, and surrounding tissue that was involved in surgery. This includes a body organ or a space between organs. This type of infection may show a discharge of pus coming from a drain placed through the skin into a body space or organ. Depending on the type of SSI, its severity, and location, an SSI can develop within 30 to 90 days of surgery. When patients develop an SSI, they may require different care needs and experience altered outcomes. Consequences include increased length of hospital stay, hospital readmission, additional antibiotics, increased pain, hardware or fusion failure, and additional surgical intervention. These consequences can lead to increased costs for the patient and the hospital, be devastating to the patient's quality of life, such as nerve damage, extremity weakness and pain, and even lead to death. The following are modifiable patient comorbidities that increase the risk of the patient developing an SSI. Patients who smoke have a decrease in tissue oxygenation, which can negatively affect wound healing. Hyperglycemia negatively affects the immune response and wound healing. Poor nutrition, which is seen with a low serum albumin level. Obese patients with a BMI greater than 30 have an increased risk because of longer operative times and increased tissue trauma from retraction and dissection. And finally, patients colonized with MRSA, methicillin-resistant Staph aureus, can be at a higher risk for SSI development. It is important that perioperative teams implement multiple evidence-based practice improvements at the same time, rather than individually. This is commonly referred to as a bundle. Bundled interventions include vancomycin prophylaxis, diluted povidone iodine irrigation, and preoperative nasal and skin decontamination for MRSA protection. Researchers suggest that a pre-op hemoglobin A1C level below 7.5 can help prevent deep incisional SSIs. A verbal nutritional assessment and lab studies, including serum prealbumin, serum albumin, and serum transferrin, can help providers identify patients at risk for malnutrition. Has your client developed a surgical site infection through negligent actions of a hospital, or perhaps the SSI was not properly diagnosed and the infection worsened? Let our team scour through medical records to help build a solid case for you and your client. This is Brenda Zackel, bridging the connection between medicine and law.